the some of the data and go over it quickly. We'll have our regular briefing on Thursday. Unfortunately, we've lost 9 members of the community over the last 24 hours to the virus. Let's go through this. 5 residents in the hospital, a male 87, male 64, male 64, and male 61, female 65, and we lost 4 residents that passed away in nursing homes. So, very tough day. Just a really sobering reminder that this virus is vicious, and we've lost many members of our community way too early. So please keep their families and all of our thoughts and prayers as an Onondaga County family. Looking at cases are down today, 277. So each week we try not to get too excited on low days and not too crazy on high days. We try to remain balanced. What we've seen the next few days are going to really tell the story on the Christmas surge. It's been an uptick, certainly, but it's not been what Thanksgiving did to us. Remember, we went from Halloween uptick, and then our new level of cases was where it was at the high peak of Halloween. And then we got an uptick from Thanksgiving, and that's kind of where we leveled off. Then we started to go down, and we had 2 weeks of good case data, and it seems like we've lost that ground, but haven't lost all of it yet. So we were prepared for caseloads in the 600s and 700s for our investigative teams for tracing and investigations, and thankfully, I'll knock on wood, we haven't had to use them because cases have gone the right direction. So 277 for cases today. 13 out of the 277 are senior facility residents. So from a percentage standpoint, again, that's important. These senior facility residents have been they get very sick, they go to the hospital, ICU bed, and we've lost way too many of them. So seeing less cases out of there, they were about 15% of our cases a week ago. Now they're in single digits and low single digits. So I think that's also part of that is that for the most part, the vaccine first dose has gone through nursing homes. There are still a couple that were being done this week, but for the first dose was done about 2 weeks ago. So that seems to be effective in helping us with this. Looking at hospitalizations, 304 in the hospital, that's down 7 from yesterday, 46 in the ICU, 26 residents of nursing homes and senior facilities are in the hospital, but they've recovered through our partnership with Loretto. I want to thank our friends at Loretto. They'll be opening up a second unit for COVID transitional unit. So these 26 residents will get transferred from the hospital to that unit. And then when they test negative, they'll get transferred to their normal residence. So certainly that will help hospital capacity as it looks like capacity is kind of stabilized. Still too high. Our hospital workers, thank you for everything you're doing. All of our frontline workers, I know you're working hard and you're working overtime, but we still got to do our part and distance and avoid social gatherings at all times so that these numbers go down and go down drastically over the next 2-3 weeks. Active cases are down to 4,440. That's good. We had a lot of recoveries over the last few days. And looking at this week, most of our school districts went back to in-person learning into their hybrid schedules. We've done school testing. We're doing school testing to make sure that we're not missing anything. Again, with schools, think about it this way. Mom, Dad, if your child's sick, they're not going to school. If they go to school and they develop symptoms, your school will call you and tell you they develop symptoms. You got to get them out of school. This has happened to me as a parent. So if you're a faculty member, you're an adult. Obviously, you're not going to work sick. That's Rule 101 in COVID. So what we then have there, besides being regulated circumstances in the building, mask wearing, hand sanitizing, physically distancing with the desks and the teachers, very good and controlled environments. And now in addition to that, we're doing the asymptomatic testing. So we're looking for asymptomatic carriers that don't show symptoms. And so yesterday, again, a very good day with a positive rate very low. Today, we're making it broader, and throughout the rest of the week, we're going into various school districts searching for these little asymptomatic carriers. So I'll put out that data later today, as that's important, but the data has been very good. So that's important for us to understand and to really drive our decisions based off of the data. Vaccine, a lot of talk about the vaccine. The governor talked about it again today. Here locally, we have a pod. Our pod started last week, where we got some vaccine from our hospitals. This week, we got some vaccine directly from the state. So our goal is to get this vaccine used and used quickly. So that will happen on our registration for those health care professionals in Phase 1A. We had them booked. We put it open. Every day got booked. We've increased, once we received the vaccine today, we increased the hours of operation so that we can add more appointments. So that's important. So we will do a lot of vaccinating this week. For those, if you can't get an appointment because they get booked, please wait, check every night. We'll be opening up appointments for next week soon if we haven't already. But again, supply drives everything. So as the federal government brings supply to the state governments, the state government then gets the supply out to the hospitals and your hubs. And our county is one of the first counties to get direct supply of the vaccine. As we get supply and we get notice of the supply that we ask for, that gets delivered, we will open up the vaccination time for the correct phase. So we are staffing up to the supply that's available, and then certainly staffing up in preparation of more active phases. So there's never going to be a time where we in Onondaga County and our health department is sitting on vaccine. What we get, we will use that day based off of the registrations that we have. So that's just how this will play out. Please feel free to continue to contact us. We're getting a lot of inquiries, but certainly it will probably be a couple more weeks, it looks like, with Phase 1A. And then the governor will outline like Phase 1B, and we'll start that knowing that that's more people, and we'll be asking the state for more vaccine so that we can get more shots in arms quickly. So saying that, again, overall, it's one of those days with COVID. We lost too many people. Cases got a little bit better. Hospital numbers got a little bit better. We'll vaccinate, close to 800, 900 people today. So that's a positive. But with this pandemic, there's peaks and valleys. We all just need to stay in this together and work together and continue to find our balance.